Ready with the slides? In the meantime, good morning, everyone.
Good morning.
Okay, cue for time. My intent is to prime for conversation. That's it, pretty much. So my goal, though, is to cover lessons learned from 25 years. I loved your comment about what you call men who've been working for 25 years on a problem. Young, right? It's a kind of a tall order. So what I'm going to do is simply give you cues to our conversation. Look at the yellow highlights, look at the bold words. Listen to these three phrases. Hard knocks, possible paths, meta capacity building. Hard knocks because like the road less traveled, that famous first sentence, life is difficult. This work is very difficult. The lessons learned that I'm distilling for you have been hard learned. That's the bad news. The good news is, because of them, we've discerned some possible paths to the future. I'll talk a little bit about that, at least in the last slide. And also in that slide, I'll talk about capacity building. That's just phrasing to get your attention, but what it's about is building capacity and linked education, healthcare, and public health systems so they can in turn help support capacity building in local communities. Wow, so first slide, 20 more, we're doing just fine. So the quintessence of Prosper, which is a primary project that I'll be discussing with you, is partnerships. This is the structure. It's a 4-tier model. I'm going to focus on community teams. What you need to know is, as suggested by this slide, there's a lot of bi-directional communication. They're very actively supported by prevention coordinators who supply TA, and they in turn get TA from the researcher and folk at the university level. A little bit about what those teams are all about. Sustaining evidence-based programs, elected from a menu for middle school kids to prevent substance misuse. Family programs, school-based programs, evidence-based, and then from the get-go, emphasis on generating support and resources for themselves. Why? To do goal number 2, sustainability goal number 2 is building and maintaining their team. Internally, we work with them very carefully about making sure they're representing all sectors of the communities, and that they're appropriately diverse, as indicated, and externally to work closely and carefully with their communities. It works, and this is something we may want to talk about because the charge was about talking about what works. So we got a lot of studies, published studies, on every aspect of this process and outcome, and ultimately what we care about is these intent to treat demonstration of community-level outcomes on a range of problem behaviors in a cost-efficient and cost-effective way. This is hot off the press, just to give you one example of a current issue, prescription drug misuse in young adults for the programs that started when the kids were in 6th grade. So what needs to be in place? Again, distillation, we were asked to provide some articles. We do have an article that gets into this in more detail, but existing infrastructures, sustainable teams, as I just mentioned, with really strong technical assistance and capacity building focusing on critical tasks. And I'll run through these very quickly. But the infrastructures include state systems in our case that are linked. In the first instance in our original project, how many people have heard of land-grant university? It's getting better. Yeah, yes. And the public school system, they reach every community in this country. Theoretically, that reach provides us with an advantage to reaching people. Lately, we've been working with military family support systems as well. Proactive technical assistance is just what that word suggests. Very proactive, anticipating where the teams are going, working with them in a very collaborative way, around their goals. Nearly every week, these technical assistants have contact, and they form a collaborative learning community. The technical assistants, the representatives of the community, it's very, very focused on that in a way to help them get to their goals. And with recruitment, we focus on very strategic plans. Same with implementation. They buy into the idea. We can talk more about that in the discussion. But it's cut every which way but loose. And the focus for the technical assistance is benchmarking, where a technical assistant works very closely with the team members. It works again. This just demonstrates sustained high levels of implementation quality. We from the get-go, we emphasize that our sustainability model that focuses on those two goals and keeps them there. We have some 200 tools to help them do the strategies that are listed as a means of meeting the objectives and the goals. We provide a lot of tools for helping them fundraise, including something we call a resource tracker. This demonstrates that this is what they've done on their own, and average, like in small rural communities, $23,000 a year. And here are the overarching lessons, which again, I can just touch on barely, but critically important. The relationship building, that's one way of thinking about it, and devoting a lot of time and resources to developing those relationships, focusing on those critical tasks. Early on, it's about helping communities to get ready, supporting their decision-making around what programs to choose, implementation capacity building, and paying a lot of attention to staff and turnover and orienting new staff. Something else to talk in, because it has a lot to do with fidelity and how to address it, is that third one. System levels adaptations help take care of it. And so here's my last slide. This is a meta capacity building. Three key points about strengthening infrastructure for network prevention system by building on existing infrastructures we have out there, linking with ACA healthcare reform, community benefits, a key one, prevention, workforce development, and again, building on existing resources for that, and really, really critical is innovative, sustainable funding mechanisms. Research questions, we're supposed to talk about that. We have 22 I'll share with you that are top based on a critical review of the literature. And thank you very much.